I want to thank all of you for coming. This is our fourth forum that we've had. Our store has been open for 4 years. The first forum was a nurse practitioner. We had a physician at the last two. And for this one here, I thought, well, I've been kind of exposing myself to all the information surrounding what I do every day with our customers and the various physicians that I've developed a relationship with and begun to understand some of these things. And so I thought I would present tonight. For those of you who do not know, our store is located, I almost feel like I want to move this up just a tad. Our store is located on 224 in Poland. We're just down the road. We have, see if I can find my pointer. When the store first opened 4 years ago, it's been about 4.5 years, we occupied just this section right here. And it was basically myself with a laptop computer. I have, I graduated in '85, so I've been a pharmacist for 25 years or so. And I have moved my way around every so many years, and I've worked in hospitals, I've worked in chains, I've worked for independents. I had opened my own store in Lowville when I first graduated from college, and it was always in me to have my own business. And the store, unfortunately, didn't last very long. The Farmores of the world were just coming up, and they were giving out 2-liter bottles of Pepsi and, all those sorts of things that, necessitated the closing the business. But I didn't meet my lovely wife down in Lowville. She was a waitress across the street. She now teaches math at Youngstown State. But the pharmacy per se, I mean, if you look at it, you wouldn't even think that this was a pharmacy. It is certainly a different type of pharmacy, and it was exactly what I imagined when I was sitting in an empty portion of this, I don't know if this is on, or an empty portion of the plaza there. And we were happy when somebody would come in and ask for directions, because it was very slow for a very long time. But I had in my mind what it was that I wanted to do, and I knew that working for a chain, working for the way that pharmacy is set up today, just was not something that I was interested in doing. And I went to Ohio Northern University a couple of weeks ago and spoke to the students there about entrepreneurship. That was the topic of my talk, and the notion today that to me as a pharmacist and what I see, that we have accepted the fact that we're going to be better off by going through a drive-through window and never talking to anybody about what it is that you're taking, what it is that your conditions, the side effects of the medications. And a lot of the public in general, really, I don't think that we realize when you go to pick up a prescription at the pharmacy and they say sign here before they ring you out, if you read the fine print, you're waiving your right to have a pharmacist come over and talk to you. It was called the OBRA 90 law that went into place as a national law they recognize the fact that the role that pharmacists play, and we play a very critical role in healthcare. We realize that pharmacists, because of the way things were set up, we're not talking to patients. So the OBRA 90 law came out, and now it was mandated that you have to go over and at least offer to counsel, unless the patient signs and waives their right to it. So the idea that you're signing because the insurance company wants to validate that you actually picked up your prescription, it's not. So that kind of deep down inside of me knew that that's not me. That's not what I wanted to do. What we have now, and that section on the right that we started with, we took over the second section of the building. I don't know, where's my father at? He'll be able to give us the dates. I don't know, about 1.5 years ago, and then just recently we took over the third side of the plaza, and my pharmacy staff is back there, and they could attest to the fact that we need the whole building right now. We have gotten pretty busy. One of the problems that we have, though, is that the relationship that we have established has been with physicians in other areas. The number of prescriptions that we do, the number of prescriptions that we fill, what we put together, the counseling, the phone calls from the patients, the phone call from the doctors, the vast majority of them are outside of this area. And I think the forum here tonight is to try to educate. My role as an educator is to try to get more of us within our own community. As much as I like us being busy, it's one thing to be putting something in a box and sending it to somebody. It's another thing when you realize that you're caring for our community. So the pharmacy, when I did open it, just to touch on the quality side of what we do. It's not the regular pharmacy in the sense that you think we're just counting out tablets by 5 up to 30 and putting them in a bottle and putting a label on it. I'm not sure if this is going on and going. Everybody can hear it. We have the compounding component of all of this. It's it's getting the raw ingredients. It's getting the formula, the recipe per se, from a company that we contract with, and putting it together. So it's not as though we have a commercially available tablets and capsules for some of the various ailments. What the doctors prescribe are for special needs, and there are the sorts of things that are not commercially available, and it has kept us busy. I did want to mention, as part of the education, I'm not really here to sell anything per se. I don't expect anybody to buy anything. What I expect you to buy tonight is the notion that sometimes what we think is the mainstream thought of what's appropriate and what is in our best interest and what is good. It doesn't always turn out to be that way. And our pharmacists, like I said, we've gotten pretty busy of late. And but the notion is that we want to try to care for some of those in our community.